Dr. Kathrin LaFaver is a UofL neurologist and specialist in treating disorders like Parkinson's and Huntington's. And what we're about to talk about, FMD. In fact, patients from all over the region and surrounding states are coming here to see Dr. LaFaver about FMD and FND, and we'll explain the difference here in just a second. Kathrin, good to see you.
Great, good to be here.
As always, glad to have you back on the show. All right, well, let's talk a little bit about this disorder, FMD. What does it stand for, and what is it?
So FMD stands for Functional Neurologic Disorders.
FM?
Neurologic, and
FN
yeah.
No, okay.
And since I'm a movement specialist, I mostly see functional movement disorder patients. So movement disorders meaning tremor, jerky movements, twitches, abnormal gait. So, not many people might have heard this term, although these disorders are very common. It's a bit paradoxical. And what these disorders are really it means that people with FMD have abnormal control over their movements. They either experience too much or too little movements. And the interesting thing is that these disorders were thought to be purely psychiatric in etiology. And we are learning that this is not the case.
So a lot of folks thought it's in your head, right?
Yeah, exactly. So, the reason this disorder isn't so well known is that a lot of times neurologists used to diagnose this condition, and it used to be called conversion disorder. That term is still in use and kind of comes from that notion that Sigmund Freud made popular back in Vienna and in his days. The people who are under amount of stress or trauma convert these symptoms to physical symptoms. And while this theory might have some merit, we are learning that this is not the entire story, and there's much more to learn about these patients. And as neurologists, we do have a role in helping these patients.
So if you have a functional movement disorder, as diagnosed perhaps by you, and you talked about tremors, and they have too much movement or not enough movement. Mm-hmm. So like what? Well, how does it impact the daily life of a person who has FMD?
So there's actually been studies shown that people with these conditions are at least as severely disabled as people with Parkinson's, if not more, because these disorders can start very abruptly and cause very severe movements, very high amplitude, jerking, tremor, gait problems. So people can find themselves to be going from a regular, normal neurologic status to becoming severely disabled over a very short amount of time.
Can they be like seizures? Like you'd have an epileptic seizure?
They can, and that's what my colleagues in epilepsy see a lot. In fact, about 1/3 of people who are monitored in the epilepsy monitoring units across the country for difficult to treat seizures are diagnosed with non-epileptic seizures that are most often fall in that same category of functional seizures. So it's a huge problem, and it's very much recognized and not really talked about. So I'm glad to be here to talk about today.
Again, we're talking with Dr. Kathrin LaFaver, who's a UofL neurologist and specialist in treating disorders like FMD and FND, which are similar. If I have a functional movement disorder and I'm having trouble walking, I'm assuming it impacts my daily life. But have you had patients who walk in and say, I can't even get out the door to go to work, and their previous doctor has said, you know what, it's all in your head. You need to get up and walk, and you need to go to work. And they come to you and you say, no, you really got a problem here.
Absolutely. So a lot of times there's a lot of misconception, and it is thought, some people erroneously think that people fabricate these symptoms, and that sometimes happens in medicine. It's called malingering, when someone really wants to get on disability and just basically fakes their symptoms, but this is not the case with these patients. And, the study we recently published in Neurology is, I think, one of the first ones really showing that there are changes in the brain structure that might explain why some people are more at risk of getting these disorders.
And that study showed what? That there was a change in the brain, or did you do MRIs, or how did you figure this out?
So this is a study called Gray Matter Differences in Patients with functional movement disorders. And I was involved in the study during my time at VNH when I was a fellow there, and when Kathrin was kind of a main person finishing up the data collection and doing the majority of analysis. So essentially the goal for this study was, how are the brains different? And there's already been some research done on functional MRI, basically looking at the brain function of patients with these disorders. And this specific study looked, is the gray matter, so that's where really our neurons are located in the brain. Are there areas in the brain that differ between patients with FMD and healthy controls? And so what we found is that yes, there are areas, and specifically areas that are called limbic areas, or emotional, regulating the emotional system. A lot of these areas have a higher gray matter density, gray matter volume, and some areas involved with motor planning have a lower gray matter volume. So very interesting, and kind of supporting this hypothesis or this theory. But yes, there are changes, not only in brain function, but it appears to be also in brain structure that interfere with normal movement control.
And does that come on just suddenly, and there's a big change in the brain suddenly, or has that been the way that the gray matter in the brain has been all along for these people that have developed FMD, and it just sort of came on and hit at a certain age?
So that's a very interesting question. And unfortunately, we can't really answer it with this study because it was a one-time imaging. And it was the majority of the patients has had chronic symptoms in this study. So what would be very interesting is to monitor these changes over time and, for example, see, well, once patients are treated, do things get better or, reverse to more normal structures. But yeah, I think there remains to be a lot of unknowns and a lot of things to be studied, and exactly who is at risk and how these disorders really start.
And the goal of this study was what? Just to get a snapshot, I guess, of what the brain matter looks like for these folks that are suffering from this at that time and space? Or is the goal ultimately to try and figure out, is there a way to reverse that?
Yeah,
and
so
down the road,
essentially,
maybe a while, but
right. And as you know, we have one of the few treatment programs for FMD in the country called the MORE program, or Motor Retraining Program. And so we have shown, and we see every day that yes, these disorders can be treated. But the goal of this study was really looking more, well, what areas of the brain are different, if any. And I think it's lending support to our claim that, well, we need to treat this as a brain condition and really take these patients serious. And it's not just, should not be equated with malingering or factitious disorders. These people do have underlying structural and functional abnormalities.
it's real.
It's very real.
Okay.
And I think every neurologist who really sees these patients and is very aware of that. Pictures go longer than words, right? So kind of really demonstrating that, I think, goes a long way, and hopefully lending more credibility and more attention to these patients, because despite being so frequent, there's very little research funding. There's no, very little kind of attention really paid to these patients. And treatment, everyone, neurologists will always tell people, well, this is what you got to do. You got to see some physical therapy, you got to see a psychologist, and kind of they'll work together in getting you better. But there's very little therapists actually trained in these disorders.
Talking with Dr. Kathrin LaFaver from the University of Louisville. She's a neurologist and a specialist in treating these types of neurological disorders. And you run one of the few clinics, right, in the area or this region that treat these folks, that accept these folks that have perhaps run out of options or haven't been able to convince their doctors wherever they're from that they've got FMD, right?
So we started the Motor Retraining Program in 2014, and it's run by Dr. Kalin at the Fraser Rehab Institute. So usually people see me in clinic first, and we have a multidisciplinary assessment along with a psychologist and a physical therapist. And if you find them to be good candidates, we admit them for a 1-week stay. And so we have treated close to 100 patients now from 26 states. So most from this area here, Kentucky, Indiana, Ohio, but people have come from all over.
Just to come to this Fraser
program
Rehab at the University of Louisville to go through this program.
Because unfortunately, there's just only a handful of dedicated treatment places in the U.S.
Are these people coming here knowing that they have been they've been diagnosed with functional movement or functional neurological disorder, and they show up on your doorstep and say, "Can you help me?" Or is it a case where they're at their wits' end and they haven't been diagnosed, and they show up on your doorstep and say, "Hey, I think I've got something. I'm not sure what it is. Can you tell me what I've got?"
Yeah, it's a little bit both. I mean, certainly we see people for second opinions who haven't been diagnosed, but for the specialized FMD clinic we run, this is usually for people who have been diagnosed elsewhere and come for the treatment program.
And you said you've treated about 100 folks from all over here at the University of Louisville and at Fraser Rehab. How many folks in the United States have FMD? Do we have any idea, since there's so little research on it?
Yeah, so it's really not, the prevalence is not very well studied, and it always kind of depends on how broad you define functional symptoms. But there was a pretty good prevalence study in Scotland earlier this decade, and they showed that up to 30% of people in neurologist's office have some functional symptoms. And it's actually the most common reason people see a neurologist, secondary only to headaches.
Well, as you know, we did a story on one of your patients that was in town. I think she was from Cincinnati, and she had video of herself just having these horrible tremors. And, she said her doctor really thought it was all in her head. She shows up, and she could not, she said, walk without stumbling. She had trouble walking her dog. She had trouble fixing herself some breakfast. Those kinds of things. So her life was really, really impacted. And then she gets to the University of Louisville, and you put her through what? What kind of things did you do to get her life back on track so that she could deal with this? And she had functional neurological disorder, FND, right?
Sure, yeah. So the MORE program is a 1-week, very intensive rehab program with PT, OT, and cognitive behavioral therapy methods. But, for a lot of these patients, it's really learning methods, how they can get this control back. And, there's some miswiring, miscommunication of the emotional and the motor centers happening in the brain. But we have seen it over and over again that even over a short amount of time, people can learn how to control these symptoms. And many people have been able to maintain their success now for several years. So it's very encouraging. Although I always do caution people, it's most often a more chronic condition than not, and meaning they learn some methods that they need to continue to work on and apply in their lives.
They can cope with it or deal with it. You can teach them how to cope with it.
And how to get in control, but it doesn't mean that the symptoms are going to be completely at bay for many of them.
All right, so people who are listening to this and they know they have a loved one, or perhaps they have been having some tremors and things, and a doctor just can't figure out what the problem is, what would you tell them to do?
Well, I think seeing a movement specialist for a dedicated evaluation, because, a lot of times tremors get called Parkinson's or essential tremor, and it may or may not be the accurate diagnosis. So some telltale signs for functional disorders is if the disorder starts very suddenly, if the symptoms vary to a great deal over the course of a day or over weeks, if there's intermittent periods where they don't have symptoms. So some of these things can be telltale signs for functional movement disorders.
All right. Again, Kathrin LaFaver, Dr. Kathrin LaFaver. It's let's see, your name is spelled LaFaver, right? So track you down at the University of Louisville if folks want to get in touch with you and think they may have something similar to this, right?
Sure, we're happy to see people.
All right, Dr. LaFaver, always great having you on the program.